and she wants to do her master's in public health with a concentration in epidemiology.
Hello, good afternoon. I am very, very excited to be here. He pretty much explained my little biography. I am a fourth-year student at the University of Texas at Austin, triple majoring public health, global health policy, and human development. Now, I did spend 3 months of my summer in Bangladesh working at the HUP clinic. So basically what I'm going to talk to you about today is my experiences, some of the things that I witnessed, and I'll be sharing a couple photos of my time there. So through volunteering at the DCI Healthcare for Underprivileged program, I had the unique opportunity to shadow the doctors and work alongside the social workers of the clinic by visiting the homes of the clinic patients and witnessing their lives up close. I would like to start off by thanking all of DCI and especially Dr. Ehsan Haq for giving me the incredible opportunity to serve as a volunteer for an organization as philanthropic and altruistic as DCI. Through DCI, I have found a place where I can make a change in the world, and I am honored and humbled to have the privilege to speak to this audience today. Aside from my education background, I want to share a little bit about myself. I am a native Texan, born and raised in Dallas, Texas, but I did spend 4 years of my childhood living in Dhaka, which my parents say attributed to my crowning achievement of being able to speak fluent Bengali without an ever-present American accent, a dominating dinner topic used as a passive-aggressive jab towards my 3 younger siblings. I do ultimately plan to pursue my MPH with a concentration in epidemiology. My time with DCI has only furthered my passion and desire to dedicate my education, efforts, time, and drive towards working with organizations like DCI, who serve as a model for healthcare provision in neglected regions. According to the Bangladesh Bureau of Statistics, at the present moment, the total population of the country is at 159.4 million people, with around 49% of the population living under the poverty line, thus claiming the titles as one of the world's most densely populated countries and also one of the poorest. In the BBS's 2014 Census of Slum Areas and Floating Population, a little over 2 million of the total population accounts for the slum population of Bangladesh. Although Dhaka has many modern clinics, they are not easily accessible by the poor, and the existing limited resources available to them in quantity and in quality are both minimal and inadequate. The slum of Kalanpur, where the HUP clinic stands, is located next to several garbage disposal areas, and the slum dwellers live off of the bare minimum in huts of tin with unhygienic facilities for latrines and showers, and they have no choice but to use filthy water to wash their cooking utensils and clothes. In areas such as Kalanpur, the inhabitants are struggling to earn a living for food, and as a healthy lifestyle is not a luxury they can afford, they also do not have the education or access to education to foster and develop healthcare awareness on their own. Unfortunately so, due to the need to be able to sustain families in the Kalanpur slums and the need to educate children from a young age, it's completely overshadowed. The mentality in the slums, as I witnessed for 3 months, is that if you are physically capable of earning a wage to feed your family, that trumps any serious need to receive even a basic level of education. Despite the challenging geographics of the area and the arduous demographic being treated, the HUP clinic is aiding the residents of the Kalanpur slum by not only turning away anyone in need and not refusing treatment based solely on anyone's financial standings. In this way, they are restoring a level of humanity to the inhabitants who, without the dedication of DCI, would fall prey to neglect. Every new day in Bangladesh, I was more and more excited when I would come into the clinic, and as I would continuously witness the astonishing commitment to the clinic on behalf of the staff, attending physicians, and social workers. The care for patients was not just of a one-visit occurrence, but was an entirely holistic process, from the initial diagnosis of the doctors to the persevering workers of the clinic, who assisted the clinic by personally visiting the homes of the families, identifying their needs, and giving them all healthcare-related support. The HUP clinic not only provides preventative and curative care for the slum dwellers, but also arranges awareness classes for young girls such as I, and also for expecting mothers, in order to educate them on issues such as healthy hygiene habits and healthy sanitation habits to reduce common and waterborne diseases, along with safe intercourse practices and also prenatal and postnatal care to pregnant women to decrease mortality rates of newborn babies of mothers. While at first I thought that all of the information that was being presented in these seminars was just common knowledge, I momentarily put myself in the shoes of one of the girls or the mothers and realized that this common knowledge that I have taken for granted by being brought up in a first world country is actually not common knowledge in this third world slum. And then I truly realized the deep value of these seminars. It became clear that attendees would most probably not receive this type of vital information elsewhere. Many nonprofit organizations such as DCI have set up many clinics in countries similar to Bangladesh, not only to provide health care, but to be able to provide basic education with regards to taking care of your body. Again, the awareness these organizations raise on basic concepts such as healthy hygiene habits, healthy sanitation habits, safe intercourse practice, and more. While these may be ideas we often take for granted, these concepts are very, very important to teach to those who have no access to a basic education, or even for those who are unable to read and write as a result of never having received basic education. This is where the in-person verbal seminars play a very important role in the effort to raise awareness through a verbal exchange of ideas and discussions. When organizations like DCI enact programs such as verbal discussions with teens or adolescent girls of a poor slum community, they ensure that a neglected and vulnerable community is being taken care of in an incredible way. I know for a fact that Bangladesh is not the only country to face issues and adversities such as these, but change starts at the root level, with simple ideas and just the heart to help those who really need it. Through my volunteering experience at the HEP clinic, I realized that there is indeed a great necessity for organizations to work in different areas of the world and keep not only bringing healthcare and humanitarian issues to light, but actively doing their part to change the world. The incredible dedication of DCI to aid the underprivileged population of Bangladesh is what I witnessed every single day of those 3 months that I set foot in the HEP clinic, and which allows me to put a greater trust and confidence in the true mission of organizations like DCI as they build a better tomorrow. I feel truly honored to have been a part of that building path this summer, which has educated me, changed me, and inspired me. I am eternally thankful for this opportunity presented to me by DCI, and I will continuously be encouraging my peers, along with any students who are interested in medicine, public health, or humanitarian causes, to come and volunteer with DCI, because it is a life-changing experience. DCI is comprised of caring, honest, and extremely generous people who want the best for the communities they serve. Once again, I would like to extend my gratitude to DCI and especially Dr. Hawk for allowing me the privilege of volunteering with this organization and for inviting me to be here today to share my experiences with you all. Thank you so much for your attention.